Good afternoon, everyone. My name is Kathy Purdy. I'm the marketing manager at Schoeneck King. I'd like to welcome you to this week's update and discussion on continuing legal and practical issues related to COVID-19. Just two quick housekeeping items before we get started. Please enter your questions through the Q&A box located at the bottom of your screen, and our presenters will do the best they can to get to those at the conclusion of today's presentation. Also, once the webinar has ended, if you would take a moment to complete the brief survey, we would greatly appreciate that. So without further ado, to get things started, I'm going to hand it over to Pete Jones.
Thank you, Kathy, and good afternoon, everyone. We've got a full agenda for you today. We're going to start off with a little update on New York State paid sick leave with Teresa Rusnick. And then we're going to shift over to Sam Burgess to talk about one of the relief programs. We're going to talk about some frequently asked questions. Andrew Bobrek will be handling those frequently asked questions on reopening. One of the things we've noticed every week here is that we get a steady stream of questions that we've covered, but they're elusive. And so we tried to put a few of those together in terms of the recurrent questions. Maybe it's a reminder for some, but it certainly is something that we see periodically from people, the kind of recurrent questions. We're going to talk a little bit about wage and hour claims. We're starting to see an uptick, in that, things that would relate to COVID and some of the issues associated with that. So Kate McClung is going to walk us through that, and then we're going to have Katie Anderson talk about the metrics and where we are, because everyone's kind of keeping their eye on where we are regionally, locally, what might happen here in New York and beyond. So we'll finish with that this afternoon. So I want to turn it over to Teresa to start. We've titled this Three Big Things, but I'm going to guess you might get a bonus thing or two from Teresa. Teresa, take it away.
Thanks, Pete, and hi, everyone. Thanks for being with us again today. For those of you that have attended our paid sick leave targeted webinars, you're going to recognize Andy and I've come to you today to once again give you some basic information on New York State paid sick leave. Pete said three things. I'm actually going to answer the four most common questions that I get for paid sick leave in hopes that that will be of some help to all of you. The first and most common question I get is, Teresa, tomorrow is September 30th. That's the day that accruals are supposed to start under paid sick leave, and we don't have guidance from Department of Labor yet. What are we supposed to do? So I understand it's very difficult with the position that New York State has put us in. We still do not have guidance or regulations from the Department of Labor on paid sick leave. We are at Bond monitoring this very closely. The second we know, you'll know. Obviously, we'll do a webinar to update you on that. We'll send out blog articles. We'll do our usual information campaign, but we don't have those yet. So in terms of what you need to keep track of for tomorrow when paid sick leave accruals start, really the most important thing you need to think about is how you're tracking your employees' hours so that on January 1, you know how much paid sick leave to give them. And remember that paid sick leave accrues at a rate of 1 hour for every 30 hours worked. So as long as you're able to track your employees' hours adequately, starting tomorrow and going through December 31st, that should put you in good shape to figure out how much leave you need to give them on January 1. And then hopefully the guidance will address things like notice and documentation and use issues and things like that. If you're looking at your policies and you're thinking about whether or not to distribute them, I would urge you to hold off on that until we do have guidance or regulations from the Department of Labor. If you want to issue a short statement to your employees explaining that you as an employer are complying with New York paid sick leave and that as soon as you can, you'll get them a full policy as soon as New York, provides you with more information, I think that would be fine. If you need to issue the policy for some reason, certainly you can do that. I just urge against it in a slight way just because we don't have all the information I expect we're going to get from New York State. And I wouldn't want you to promise something in your policies that you then would want to walk back once we do get that guidance or those regulations. So that's the most common question I get is, what are we supposed to do? Paid sick leave starts tomorrow. I'm still getting a lot of questions about who's covered by New York State paid sick leave. So it does apply to all employees. That includes part-time, seasonal, temporary, and per diem employees. Basically, anyone that you give an IRS form W-2 to is going to be considered covered for New York State paid sick leave purposes. Now, you can treat employees with, in different classifications differently. You can front load for your full-time and accrue for your part-time, or front load for your part and full-time and accrue for your per diems, but all of them need to be covered, at least according to the statutory minimum, as we are aware of it at this date. One of the other questions I get commonly is, can we cap carryover and accrual under New York State paid sick leave? The answer to that is not yet clear. New York State allows, by the terms of the statute, employers to cap use of paid sick leave at either 40 or 56 hours, depending on the size of the employer. It does not provide similar language in the statute regarding an employer's ability to cap accruals or carryover. At this point, we do not know if employers will be allowed to do that. The guidance hopefully will clarify that when we receive it from DOL, but right now we are treating the statute as saying that the employer is not allowed to cap carryovers or accrual of paid sick leave. Another question I get is, can we require notice and documentation? I know a lot of you are used to having in your policies and familiar with, laws that allow you to require a 30 days notice, or notice as soon as is reasonably practicable, or documentation after 3 days of absence. All of those things are reasonable and for the most part allowed. We just don't know if they're allowed under New York paid sick leave yet. The statute in and of itself is almost completely silent on notice and documentation, only stopping to say that employers cannot require the disclosure of confidential information prior to granting paid sick leave. It does not define confidential information, and it doesn't give any more information than that. So notice and documentation requirements are something, please, just kind of flag those in your policies and hold off on making any definitive changes to them until we have guidance or regulations from DOL. And then finally, a question, I'm still getting a lot of questions about how to integrate your policies, your current PTO and vacation and other paid time off policies with paid sick leave. The statute does provide that employers are allowed to do that as long as your existing policies meet the use, carryover, and accrual requirements of New York State paid sick leave. So I recommend that you kind of start with those big three, use, carryover, and accrual, and go from there when adopting your policies. And Pete, I think those are my big four, maybe big five, and I'll turn it back to you.
I knew that you'd give a bonus or two. Let me, quick question for you. A couple of people have asked, what about public employers?
Public employers, if you're considered a government agency, are not covered by New York State paid sick leave.
Okay, great. Thank you, Teresa. I appreciate that, and we'll be on the lookout for the guidance. I mean, one of the things I think people can keep in mind is, although accruals would start September 30th, or you have the option to give, a bank to employees starting on January 1, depending on your employer size, we still have some time to figure this out. So I think it's nerve-wracking for folks because we know there's this statute, we want to get prepared, but in the absence of guidance, I think we'll just have to kind of wait and see and use this additional 3 months to try and sort through it. Hopefully we'll get something soon from the state. Okay, next up here, we've got Sam. Sam's going to give us an update on one of the relief programs and take us through that. Sam, take it away.
Thanks, Pete. It's good to be back here with everyone, and today we're going to touch on a topic that haven't given much thought to since, one of our probably earlier webinars. But for healthcare providers that receive provider relief funds, everyone's been kind of wondering what that money can be used for, what we eventually are going to have to report, and, what happens if we have excess. There was no, clear language besides, it's expenses related to treating corona, preparing for coronavirus, in caring for patients, which was broad. Pretty much anyone could be considered a patient for coronavirus purposes. But late last week, or maybe the weekend before, we finally received the reporting requirement guidance. And in this, it broke down what the necessary elements are going to be, what data is going to have to be provided, and how you can use those funds. It provided some detail on, what's considered a healthcare related expense, and, provide the timeline. So first, for any provider that's received over $10,000 in provider relief funds, these reporting requirements apply to them. There's a few exceptions, but there's no need to get into those for the time being. So then, how do we use those funds? Everyone's presumably used those. We've been under the impression that lost revenues, everyone's losing revenue because, we're not at status quo, we're not seeing the same amount of patients. But they came up with a definition for that and described how we have to look at that as well. So the first thing you can use them for is for healthcare related expenses. And a big key in this is that it's expenses that aren't obligated to be reimbursed by another source or weren't reimbursed by another source. So for example, they broke down different categories to, payment of mortgage and rent, insurance costs, personnel costs, fringe benefits, utilities and operations, and then just a general overhead, any other general overhead expenses can be considered in there. But if you received, say, a PPP loan, you can't double dip and take the money from the PPP to pay for your payroll and then also claim that as an expense for this purpose. Same way if you got a grant, I know there's a lot of local grants going around, to help with purchase of PPE. If you got one of those grants, you can't then say that that was some of your expenses. So the first item we do is we take all of those expenses and we put them on a line to show how much we've accumulated. If that doesn't cover all the amount we received, we can then go to specific healthcare related expenses, those supplies, specific equipment we needed, IT infrastructure, maybe if you need to increase your bandwidth or provide, information technology, system updates, telehealth, teleworking, things of that nature can be included in here. Also, if you had to, build out your space, put in partitions, you took on new space to accommodate patient treatment, that would all be expenses that go in there. So those are the first two items. That's where we stand for healthcare related expenses, where money can be used in that capacity. When we report this, if you receive less than $500,000, you only need to report two separate line items. Your general and administrative expenses, all of those items I listed first, the mortgage, the insurance, the personnel costs, and then the second item of the healthcare related expenses. However, if you received over $500,000, you're going to have to line item all the separate subcategories listed to break out what applies to what specific expense. So if you haven't already, it's wise to start getting your receipts, getting your expenses documented, putting together a spreadsheet so you can see where you stand. If you still haven't spent all the money, we can next look to apply it to lost revenues. And the lost revenues was a piece that was very unclear to start. We didn't know if it was, lost revenues from the same period last year, lost revenues, based on what your growth projections were, or, the way you were trending this year. And it came out to be that it's patient-centered care, the revenue for patient care directly. And it's just a net change from 2019 to 2020. So we look at the difference between those 2 years for your patient revenue, and that's where you can determine your lost profits or your lost revenue. But one caveat on that is when we're looking at different expenses that might be included in there, we can't then add in the healthcare related expenses that we're adding above. So they're two separate calculations. We have to make sure we're not using them twice. So that's the basics of it, of the information that we need to gather that we're going to need to report. But then just for your knowledge too, you're also going to need to report, information regarding any other funds you've received, your normal contact information, things of that nature. There may be some other questions regarding, your organizational structure. But that's the basics of it. It does provide some more guidance. There's still some things that are unclear, some discrepancies that people may have. And we've been told that they're going to continue to provide, some webinars and frequently asked questions. But, kind of like Teresa mentioned, we can't really rely on that as it's been quite some time as we've been waiting for these guidelines. So, but we will keep an eye on that and see if anything else comes up and continue to update you. But you should start working on your end. And just the last thing I want to mention is for timing. We still do have time because the system does not open until January 15th. The first reporting deadline is February 15th, and that's if you expend all the money by December 31st. If you don't expend all the money by December 31st, you have until July 2021 to expend it all and report on it. But just note on that, if for 2021 you cannot look, you can still not look to double dip on some things that you've already accounted for with your lost revenues and your healthcare related expenses. So I'm sure there'll be more guidance coming, but that's just the initial detailed instructions, and we wanted to provide those to everyone so you can get started on collecting the necessary data. Thanks, Pete.
All right, thank you, Sam. And of course, we recognize that a particular topic is limited to only some of our clients, but we're trying to keep you updated on everything. That's also, we think that the beauty of this webinar is that we touch on everything briefly. If a particular topic doesn't pertain to you, hang on for about 5 to 7 minutes and we'll hopefully get to one that does. Transitioning now, we thought we would we're getting a lot of these questions, as I mentioned before. They're things that we've talked about, but they're repeatedly coming up, and they're difficult issues. So we're going to let Andy Bobrek tackle that. Andy, take it away.
Hey, thanks, Pete. Great to be with you, everybody. As Pete mentioned, yes, we continue to get a lot of questions, COVID related. As business and organizations here in New York continue to operate, expand their operations, bring people back to work. We wanted to cover a few of these. Certainly this is not an exhaustive list, and certainly please continue to submit your questions during the course of this webinar. Before I hopped on here, I was trying to answer as many as I can. I'll do the same afterwards, and I know that my colleagues here on this webinar will do the same. Pete, one question that I've gotten quite a few times recently is about the daily records that we're keeping, right? So I know myself here at Bond, I complete a questionnaire every day at the start of the day that goes through the 3 required questions that the state has mandated in its guidance. And then the question is, all right, well, do we have to keep those, or should we keep those, or can we keep those records? This is an issue that the state, you need to look at the particular guidance that applies to your industry and what phase you fell in. But the theme that's consistent when you look at the manufacturing or the office setting, for example, as well as other settings, is that yes, you can keep certain of this information. What specifically is said that you can keep proof that this check-in was completed, and in fact, I would submit that you absolutely should keep that information. Proof that the survey was completed and that the employee passed the survey. In other words, they answered the questions correctly that would allow them to come into the office and work that day, for example. But that you can't keep any specific employee health information. So if we're recording a temperature, for example, we can't keep that temperature information, but we can keep a record showing that the employee passed the test, and we should do that. So again, another question that I'll get that's related is how long should I keep these records for? I don't have an answer to that right now. For me, I would keep it certainly for the time being. Generally, and there's no requirement per se of how long you need to keep these records. That's in any of the guidance or statutes that I've reviewed. In the absence of that type of guidance, typically we'll recommend keeping things for at least 6 years. That generally is the longest statute of limitations on a claim that could be brought. But for the time being, I would recommend that you keep those records indefinitely and until you hear otherwise. Pete, a second question that we've gotten, and this one's come up of late too. So we have an employee who it reports having COVID symptoms, maybe checks the box that they had a fever or they have a cough or something that, you know, is one of the symptoms that we need to track. And if an employee reports that, not allow them to come to work. But at the same time, the employee doesn't go to the doctor, won't go to the doctor, won't get tested for COVID-19. And again, hopefully in 99.9% of the cases, right, you have a symptom, you're going to go to the doctors, you're going to get checked out. And then, you know, as the employee, you're going to work with your employer to figure out how to return to work and, you know, make sure we're doing as an employer what we need to do from a precaution standpoint. But it can be challenging when the employee is just refusing to do this. And I think there is that, you know, 0.01% or 0.1% of employees who may look at this as an opportunity to abuse this leave situation. In other words, hey, if I check that box, I've got a day off, and I'd rather not come into work, and this gives me a plausible excuse. I think there's a number of questions that we have to look at when you get this scenario. First, are you covered by the FFCRA? Right? Do you have under 500 employees? If you're covered by this, I think that's going to shape your analysis and decision-making. Certainly an employee who's experiencing symptoms and is seeking a diagnosis is covered under the FFCRA, specifically the EPSL provisions of that, the emergency paid sick leave provisions of that. They could be eligible for leave under that. But conversely, right, if they're not going and pursuing a diagnosis, then I would submit they're not covered and they're not eligible for that leave. After that point, it becomes clear. And in that case, that can provide some, a mechanism to, kind of verify that employees are following through the correct process, that they're requesting this leave in good faith. And, what I've found is there's some misunderstanding on the part of employees where they may believe that they're eligible for this leave simply by just clicking that button saying I have a symptom, and therefore they're going to be entitled to a period of paid time off under the FFCRA, when, and if indeed that's not the case, the employee is not eligible for the paid leave, there's less incentive for them to take that day and to check that box where they're not truly experiencing those symptoms. Third question, how do we respond to an employee who requests leave for 2 days per week when his children are engaged in remote learning? Yeah, this is one that we've continued to get, certainly as school has begun to operate and kids are back at school. And the model that we see, although not uniformly, but commonly, is to have a kind of hybrid model where kids are back a couple days a week for live instruction at the school, or they're receiving their instruction remotely for the other 2 days during the week. This is also an issue that was initially addressed by the federal government as part of the FFCRA. Currently, there's no state COVID paid leave benefit that would apply to the situation, but the FFCRA could potentially apply. Initially, the federal government took the position that this was going to be an intermittent type leave situation, and that an employee was not per se entitled to such intermittent leave, but if the employer granted that leave and was willing to provide it, they could receive it on an intermittent basis. That interpretation was one that was challenged in court in the Southern District of New York, and that court ultimately struck down that provision. The provision, namely that the employer was the entity who alone could decide whether or not to grant the intermittent leave. So the feds recently issued new regulations. I know that's been the topic of one of our Tuesday webinars already recently, and addressed this specific issue and essentially tried to thread a needle on this. They've taken the position that if an employee comes and says, hey, My son or daughter is going to be home. They're engaged in a hybrid model. They're going to have remote instruction on Thursday and Friday. I need to take leave for that situation. That is something you're going to need to analyze now under the FFCRA. The guidance and the new regulations from the feds indicates that they're not considering that type of situation to be an intermittent leave situation. Again, they're still taking the position that employers have a say and can unilaterally decide whether or not to grant intermittent leave requests for purposes of the EPSL and EFMLA, but they're treating this particular situation as one that's not a request for intermittent leave and therefore needs to be granted. I don't want to oversimplify things. There can be some complexities and differing circumstances when this arises. I encourage you to work with your labor and employment counsel to address that when it comes up. But again, just keep those principles in mind. I think at the bottom line, when that issue comes up, hopefully a flag goes off and we take a step back and just analyze it carefully. Do I need to update my infection control and workplace safety plans? Well, potentially. The guidance depends on when you put that together. The guidance from the state has changed. They haven't necessarily made it known when they've changed the reopening guidance that they've put out. So I think it is a good idea to take a look at your plan. Frankly, it's just a good idea to do it anyway. Take a look at it. For some institutions, it's been some time since that was implemented. How is it working? Right? Are there things in there that we can supplement? Are there things in there that aren't working that we're not doing, that we've changed? Ideally, we want that to reflect our current practices and certainly what's required by the state. Pete, another one, clients have for some time engaged in quite a bit of remote work, certainly when offices were closed and couldn't be opened. And now we're seeing this continue, right? For certain industries and certain areas, this is a workable concept. And employers are trying to be flexible, certainly, and allowing more remote work and are expecting to continue to allow remote work. So do you need a policy? I think the answer there is no, not necessarily. You don't need one. There's no legal requirement to have one. But I think as a practical matter, it can be a very good idea. I think there needs to be certain expectations and understandings of how the remote work concept will operate. And there are issues that I think are appropriate to address in those types of policies or agreements that you may have with a remote worker. Again, I not required under the law, but I think certainly a best practice and something we're working on with a number of clients.
And Andy, it just seems to me, you make a good point that you might, if you go through the issues that you're talking about and decide you don't need a policy, you've kind of made a conscious choice. You've done the analysis and decided, it's working fine and our workplace doesn't need one. I think most employers, when they do that, would probably conclude they ought to memorialize something. But I mean, the thing I think we are counseling against is, not thinking about it. I mean, think it through and then decide what's best for you and tailor something that works.
I think that's right, Pete. Yep. Not only the practical issues too, but giving thought, maybe your employee who's providing services remotely isn't situated in New York any longer. Maybe it's somebody working in a different state. And again, that's hopefully one of those times where that flag goes up for you and say, all right, well, we need to take a look at that particular jurisdiction. Are there any requirements that may apply to us as an employer by having someone who's remote working in another state? Again, I think that's something you need to carefully examine when you look at the remote work options. Finally, Pete, if we have an employee who is scheduled to travel to a hot state, we know it's a hot state. We have every indication it's going to remain a hot state. This vacation is going to be for a week or 2 weeks, and then we know the employee is going to be potentially subject to a 2-week quarantine when they return. What can we do in this situation? Well, here, at least for purposes of the New York State paid COVID leave, the state has made clear that so long as the employee is effectively put on notice that, hey, this is a hot zone, you're subject to a potential self-quarantine or isolation when you return, as long as that advisement is given that that employee is not eligible for the state COVID paid leave, where you're otherwise subject to a governmental isolation or quarantine order. However, it still leaves potentially the FFCRA, and for those employers who are covered by this, and potentially some coverage for an employee in that situation. Even though they're not eligible under the state law, they still could be eligible under federal law, which again does provide EPSL leave for an employee who is subject to a governmental quarantine or isolation order due to COVID. And then it goes back to the analysis of the original directives and the executive orders that have been in place concerning this travel to other, what I call hot states. Something you should work with your attorneys on there if it comes up. But as a practical matter, I think we always start by looking at the policy. What does the policy say about how we grant or deny leave? I mean, certainly I think it goes without saying in all these issues, right? I know that as our employers, we're trying to be as compassionate, as flexible as we can while addressing these difficult issues. But at the end of the day, many organizations and entities are running fairly lean right now. They don't have as deep a bench to cover issues or other operational matters as they maybe had before. And so this can be a legitimate practical problem. Perhaps once, certainly talking to the employee, trying to understand their need for leave, trying to understand what flexibility there may be there. But at the end of the day, it may be a situation where you as the employer have the discretion to deny that vacation request. And again, it's something I think you want to analyze carefully, but that could be an option. And you deny it based on the concern that, hey, we can at this time accommodate what would effectively be a 3-week or 4-week absence based on the exercise of vacation. And as an employer, we have the right to approve or deny vacation in our policy. So Pete, just some quick thoughts there. There's more questions out there for sure, but hopefully this provides some help to people.
Yeah, I think you nailed really ones that we continually see. And we'll get back to people with the nuance if there are any. So let's turn now to Kate McClung in our Rochester office. And wage and hour, I think, is complicated enough without a pandemic, but we have the pandemic overlay here. So Kate's got a few thoughts on that.
Thanks, Pete. So at last week's webinar, I did a presentation on employment law claims related to the pandemic in general. And I did one slide on wage and hour and one slide on COVID-19 leave. And I got a lot of follow-up questions, particularly about the wage and hour issues relating to COVID-19 leave. These are the FFCRA and the New York COVID-19 leave law are two new laws. I get questions regularly about the Family and Medical Leave Act, which has been the law for a long time, but there's still complicated nuances in that law. But new laws are always the most tricky because we're all figuring them out for the first time this year. So I wanted to go back and go into more detail about the wage and hour claims that arise from the FFCRA and the New York COVID-19 law. They have some different rules about how much you need to pay people. Some employers are making the mistake of just assuming, okay, I'll pay 40 hours a week at their straight hourly rate and I'm set. But that's not actually sufficient for a lot of employees. There's some fairly technical rules that you need to comply with. And it's important that you get it right for a couple reasons. Under the federal law as well as the state law, one employee could pursue class claims against you on behalf of all of your employees if you don't do the calculation right. Another reason is with the federal law, if you don't do the calculation right, you may end up getting into issues with the IRS as well. Under the federal law, if you undercalculate the payments and pay the employees too little, the employee could sue you or the Department of Labor could come after you. But if you calculate it as being too much, then you're taking too big of a tax credit and the IRS could come after you. So it is important to get these calculations right. So first off, let's start with the FFCRA. How many hours of pay should you pay to employees, either under the emergency paid sick leave or the emergency FMLA? So as far as how many hours, you need to use the average hours worked over a 2-week period based on their normal schedule. Now, not all employees have a normal schedule, so what to do with them? If the employee doesn't have a normal schedule, then you would look at the 6-month average of how many hours they worked per week. And if they haven't been employed for 6 months, then you use the number of hours that you agreed that they would work upon hire. If there was no such agreement, then you look at their average number of hours worked per week during the entire term of their employment. So it's sort of a checklist. You start at the top, that doesn't apply, you move down until you find one that does apply. So it is important to keep in mind that you do have to pay them for overtime hours. So if an employee has a normal schedule of 50 hours per week, normally, say it's a non-exempt employee, so normally they work 50 hours, they also get overtime premiums for those hours from 40 to 50. If they take a week of emergency paid sick leave or EFMLA, they're still going to get paid for 50 hours, but you don't have to pay them the overtime premiums. So the hours themselves need to be paid, but you don't need to pay the premiums. So for example, that employee who works 50 hours a week, if they took 2 weeks off, that first week they would take 50 hours of emergency paid sick leave. And then by the second week, remember there's that 80-hour cap, so they only have 30 hours left. So they do end up taking all 80 hours, but you want to make sure that they're getting 50 hours for the first week. This can be especially important for employees who are also eligible for New York COVID-19 leave, because you give them leave under federal law and then under the New York statute. So this employee, assuming she was eligible for both types of leave, that second week, after she's exhausted her EPSL, her 80 hours, then she might start receiving pay under the New York COVID-19 law for the remaining 20 hours of that week. Okay, so that's how many hours to pay them for. How much per hour should you pay them for? Well, under the FFCRA, it's the average regular rate for all full work weeks during the 6-month period that ends on the first date they take leave. Now, the good news is, if you calculate that for leave and then the employee subsequently takes leave for a different reason, you don't need to recalculate the average regular rate. You can still use that same average regular rate that you used from your first calculation. But what if they haven't worked there for 6 months? Then you just use the average regular rate for each week that they've worked for the employer. The guidance is a little bit unclear. If they fall into this latter category and they haven't been there 6 months, and then they subsequently take leave for another reason under this law, do you need to recalculate it then? Since the guidance isn't that clear, I recommend that you do recalculate it and pay whichever is the higher regular rate, just to be on the safe side. Make sure that you are including all amounts that need to be included in the regular rate. So, a lot of classic mistakes there: non-discretionary bonuses, shift differentials, commissions. Some more recent examples include non-discretionary incentive payments or hazard pay that employers are paying in connection with COVID-19 law. Those may need to be included in the regular rate as well, depending on how those payments are determined. So just make sure that you're calculating the regular rate correctly. So what about employees who are exclusively paid on a salary basis? Well, the U.S. Department of Labor has said that for them, you can use the hourly equivalent of whatever their salary would be. So if the salary is intended to pay them for a set number of hours per week, like 40 hours per week, you would just divide their weekly salary by 40. If it's intended to pay them for all hours worked, and their hours vary from week to week, you can either do a calculation based on, if you have records of the hours worked, you can calculate it that way. If you don't have records of hours worked, say with an exempt employee, you can use a reasonable estimate. Okay, so how does this work under the New York law? So under New York law, just as a quick reminder, employees are entitled to either 0, 5, or 14 days of paid leave during a quarantine, depending on the size of the employer. Those are calendar days and not work days. So someone who works 5 days a week would be entitled to 10 paid days of leave effectively if they work for an employer, a large employer. So what rate of pay? The While the U.S. Department of Labor has offered over 100 detailed Q&As, the New York state government has offered much less guidance for their law. So this is the answer from their website. They should be paid the amount that the worker would have otherwise received had they been continuing to work for that period, based on the amount that the employer was scheduled or would have been scheduled had the employer's operations continued in its normal due course. So when I read that, my first question was, what about overtime premiums? Because, you know, going back to my example of an employee who works 50 hours per week, that's someone who would have received overtime premiums. The guidance later references regular rates, so perhaps New York's not intending that you have to pay overtime premiums, but certainly that would still include those other types of payments that we talked about going into the regular rate. Employees, if they have variable pay, you can use a representative period of time to calculate their average daily pay rate. They don't tell you how long that should be, so, you know, the feds tell you 6 months, but state doesn't. You know, I think 6 months would be a fair period of time to use, unless there's some seasonality in your business and you're looking at a different time of year that's not really representative of how much they would have worked at the time of year that they're taking the leave. There are additional types of COVID-19 leave claims as well that are important to keep in mind. So certainly failing to provide the leave where it's required or retaliating against someone for taking the leave are definitely areas that you want to avoid as well. And that is my section of the presentation. Thank you, everyone.
Thanks, Kate. Appreciate it. Okay. There was at least up until today, I think, you know, a little less coming out of Albany. We thought we'd do an assessment of where we are. Katie may also have some late breaking news as well. So let's turn it over to Katie Anderson.
All right. Hello, everyone. Thanks for being here today. I was watching the governor up until a minute ago. Not much really was coming out of that press conference, but what came out of it, I will discuss. I will also discuss the travel advisory and those updates as well. So just hold on tight. We're coming. All right, let's do this. Can we have the first slide, please? So first thing I wanted to do was look through where we are and you know what the rates are at. This is the 7-day average. I took this today. I obviously circled 3 places where there's concern. The main concern right now is really the Mid-Hudson and New York City are seeing spikes, and I will discuss those in a second. But even the southern tier, Broome County has seen an increase in cases that's quite significant, and it's important to look at that because, again, you know, the southern tier it's a rural area. It's very different from what's going on in New York City. So those are all, you know, that's where we're at right now, and these are obviously concerning numbers because we don't want to see us have to go back, and we don't necessarily want to see what targeted shutdowns are going to look like. Today, you know, these numbers are from yesterday, but today the governor went through these numbers again. So I wrote a few things down to correspond with this, but as you can see, really the biggest clusters of these cases are coming out of Rockland County and Orange County as well. You also, you know, Kings County, Brooklyn, those are, you're seeing a lot of things bad that are happening. And one thing that the governors, you know, that they're doing, they're sending all of these rapid testing devices to these areas, to these specific zip codes. This is very different. We have to just pause for a second and remark about how different this is than it was in March. In March, it was chaos. We had no idea where it was. You know, it was absurd, right? At this point, we can go to the zip code and see where the cases are spiking so we can really try to target it and hopefully then avoid seeing you know, further shutdowns occur. So if you're looking at these clusters that are occurring, one of the numbers that was remarkable today is the top 20 zip codes that have cases in New York. they compose of 5% of what's happening in New York State. So their infection rate total is 5%. New York statewide has a 1.1% infection rate as of today. Obviously, this is concerning. The governor is speaking today with leaders in the Orthodox Jewish community. That's where a lot of this spike has been occurring. That is occurring today. Hopefully, we're going to see some progress on this. The governor also put out today, I'll say put out today, but it discussed a New York City stability and recovery plan. This recovery plan is really just a lot of the same things we've been hearing over and over. So there's not much different there. One other thing to note, though, too, is there's been a lot of questions. New York City indoor dining is supposed to start tomorrow. It is still scheduled to start tomorrow. Today, elementary school opened in New York City. This week, you'll see high school and middle schools in person, go in person. Remote learning has been occurring this entire time, but we've jumped up to 48% of students in New York City have opted into fully remote learning. So that's quite a significant change. This was announced yesterday, and we still have not seen the executive order about this. So I don't have a lot of information to give besides the following. The governor announced yesterday that travelers coming to New York from level 2 or level 3 countries, so those are countries, it's pretty much every country except for about 30 that New York State lists in the press release, but have to quarantine upon coming to New York for 14 days. That's different than what it's been in the past. At this point, we don't know how that's going to interact with the other travel advisory. We don't know if there's going to be the essential worker exception. We don't know how paid leave will work with that. We don't know any of those things because the executive order hasn't been issued and any guidance associated with that has not been issued or incorporated into the existing travel advisory guidance. So that is all, a big change. So we'll be looking out for that. Obviously, we will get that out as soon as we can. The other thing, the travel advisory, just the general one, this is a map from last week. There's one error on it. I forgot to add Rhode Island. They are so small that I always forget to click them. But I managed to remember Delaware. So you win some, you lose some. Right now, as of, right when I started talking, the travel advisory hadn't been updated. Numbers wise, it's looking like Virginia is potentially coming off the list this week. Looks like Colorado is going to be going onto the list this week, leaving New Mexico surrounded by all of these quarantine states. One other thing, that's popping up for questions, we've seen a lot of questions about where colleges are at. Right now, just in general across New York State, we've seen, the big shift to virtual learning that happened with SUNY Oneonta. We haven't seen anything on that scale since that point. But we did see, SUNY Oswego went to fully virtual learning for 2 weeks. Their 2-week period is almost up. And, we're just watching all of these schools really trying to manage this. So we will continue to be, monitoring that situation, letting you know what's happening. But at this point, every single SUNY school is scheduled to go fully virtual after Thanksgiving. The last holdout was SUNY Geneseo. But as soon as Thanksgiving is over, all of the SUNY schools will be going virtual. From Albany, that's really it for this week. Of course, you will likely be seeing more emails from me as the week goes on. So I hope everybody has a great week.
Thanks, Katie. We're obviously, everyone's sort of on the edge of their seat with those numbers. The governor early on talked about, you have that image of opening the pipeline or potentially closing the pipeline. I think for the most part, we've been opening the valve. He delayed on a few things, mall openings, things of that nature. But but we've kind of been opening the valve, and we're all hoping, obviously, that we don't have to go back to, closing the valve. So something to keep our eye on. Okay, thanks everyone for being with us this afternoon and every week. We'll be back here next week with further updates. Everyone stay safe this week, and we'll talk to you next week.